everyone, and welcome back to the Awesome Physio YouTube channel. Today we are going to be talking about the best exercises to help with menisci injuries of the knee. So with inside the knee there are two types of menisci. We've got our medial and our lateral menisci. They are absolutely vital structures for shock absorption and improved biomechanics of the knee. So when we're moving or walking, we need them to be able to help with that congruency of movement and absorb shock on high impact activities. There are two types of injuries that typically occur with menisci. So it can either be a traumatic onset, so a traumatic injury to the meniscus. So this is very common in high impact sports, so any jumping sports, or if there's any trauma. So for example with a tackle in football where the knee is at slightly flexed position, so it's bent, and then there's a rotational force coming in. What typically happens with a traumatic onset is there is an excessive force pushed and prolonged onto a normal menisci. What can happen though is we get a lot of involvement typically with the surrounding ligaments with the trauma. So this could be the anterior cruciate ligament and the medial collateral ligament, which is why it creates this unhappy triad with those structures, and they need to be assessed as well. As we get older, what can happen if we've got osteoarthritis of the knee is that can predispose degenerative damage to the menisci. So as we're moving over time and we've changed how the biomechanics of the knee work, that can wear down and wear away the menisci. So that is when we have a smaller force applied to a degenerative meniscus. So that's where it can build up over time. It can be quite hard to diagnose a menisci injury. Sometimes they can spontaneously heal on their own. Other times they may not have any symptoms depending on where the damage is, as there's lots of different types of meniscus injury. But if it is going to present, most commonly it gives joint line pain, so around either the inside or the outside of the knee. It typically can lock in a position, particularly with a bucket handle tear. If we're thinking of a traumatic meniscus injury, can give quite a lot of a dull or diffused ache deep within inside the knee, and can also be painful on weight bearing. So what do we do about menisci injuries? So for me it is really important to work out the severity and the type of injury that has occurred, and to rule out any other structures that may be involved. So what we commonly do as osteopaths is we send over to a knee specialist. We want to have a look at an MRI or a CT, or sometimes what can happen with an arthroscopy of the knee if they've got wear and tear, so degeneration or osteoarthritis. It can be diagnosed accidentally through that surgery. So we want to know what is going on, where is the injury, and does this person need surgical intervention. More commonly that is what is required for the healing, but of course what we're looking at after, so once it's repaired, we would be looking at that conservative treatment. So once the injury has started to repair, we want to add exercises in, which is what we are going to look at today. So initially we want to look at isometric quadriceps activation. So this is assuming that initial inflammation and pain has come down, and we want to start to regain movement through the knee. So what we're going to aim to do is have the leg of the bad knee straight, and you're going to aim to push the kneecap down towards the floor with a towel underneath the knee. This is getting you to very gently start to fire your quadriceps muscles, and we're aiming between 10 to 15 reps, because if we can build up the quadriceps, we start to regain the mechanical support around the knee. The second exercise, we want to look at a straight leg raise. So again, you're still engaging the quadriceps here, but more the rectus femoris, so the upper quadriceps, so the one that blends and attaches with the hip. And we want to aim lovely, slow and controlled, still looking at between 10 to 15 reps. So it's all about rebuilding that stability around the knee after potentially surgical repair or any intervention of the knee. We want to start to regain your range of motion. Next, we want to look at a seated knee extension. So this is a great way to really activate the knee with movement, so particularly that quadriceps muscle again, aiming between 10 to 15 reps. So what we're doing is we're extending the leg out, holding for a couple of seconds and then relaxing and then coming back. So where you should feel that activation is over the front of the thigh. So you should feel it into the quadriceps muscles. Again, this is very early stage rehab exercises that we're looking at today, and we want to build this up over time. So this is before we add any resistance in any way into the knee. Next, we want to start to do the exact same thing but around the back of the knee. So what I'm doing here is I'm lifting up the foot and then pushing my heel down towards the floor. So what this is doing is as you're pushing down towards the floor, you're firing the muscle at the back of the leg. So you're aiming to hold for a couple of seconds, exactly where I'm tapping there, aiming between 10 to 15 reps, and then relaxing. So we want to regain that support around the whole knee joint, so we need to activate the hamstrings. The next way we're going to be looking at is looking at abduction of the hip joint. So we want to make sure that all the muscles higher up around the hip and obviously supporting the leg are also firing. So we want to separate the knees, hold for a couple of seconds on end range, and then relax, and you should feel it around the side of the hip, aiming between 10 to 15 reps. If we can regain strength around your glute medius min on abduction and your gluteus maximus on hip extension, that massively helps with stability but also gait, so movement, moving forward. Next, we want to look at firing that hamstring a little bit more. So you're going to bring the heel towards the bum and then gently relax the knee back. So with all of this, it's always slow and controlled. So like I said, we're past that initial inflammation point, but we want to start to gently regain movement. So very, very much initial phases. Bringing the heel towards the bum, holding for a couple of seconds and then relaxing, aiming between 10 to 15 reps. Once you've activated through the hamstring, we next want to look at hip extension. So what we're doing is we're bringing the leg up straight, holding for a couple of seconds and then relaxing. You should feel this firing in your glutes, so the big muscles around the back of the pelvis into the bum area. And what you want to do is bring the leg up, holding for a couple of seconds and then relaxing. If we can rebuild the strength with the gluteus maximus, it will be so much easier on movement and stability to help with that knee injury. So although the injury is lower, we want to look at all supporting structures and joints to help improve that movement. Finally, we want to look at regaining that optimal mobility through the knee. So the knee is a hinge joint. It relies heavily on straightening and flexing, but also requires the support of the surrounding ligaments and the muscles for movement and stability. So what we're doing is we're bringing the leg out in front, holding for a couple of seconds and then slowly bringing it back. So it's all about slow and controlled, moving the knee, improving that range of motion, and then relaxing over time, aiming with this routine between 1 to 3 times per week, and then adding resistance later.